Enlarged prostate. When is it a problem? My name is Andrei Salvioni. I'm a urologist, and you're very welcome to my channel. Be sure to like and comment on our video so that it can reach more people who might benefit from our content. To answer this question, the first thing we need to know is where the prostate is located. So the prostate is a gland that's more or less apple-shaped, located in the male pelvis, below the bladder and a little above the region of the rectum actually, anterior to the rectum, above the rectum. And the urinary canal, which we call the urethra, which is the canal that comes out of the bladder, passes through the core of the prostate and then continues on and goes to the male organ. So the first thing is to know that. It's very natural for the volume of the prostate to increase over the years, especially after the age of 40, and for some, even before that. And it's natural for this volume to increase, right? For it to grow, for the prostate to grow. But there is a limit that we consider normal, around 30 to 40 cubic centimeters, or 30 to 40 grams, because this measurement is also made in grams, an estimate, in fact, usually done through a pelvic or transrectal ultrasound. It can also be measured through a CT scan or a magnetic resonance imaging. And when is this a problem? When it gets bigger than that size, actually, it can cause problems even when it's smaller than 30 cubic centimeters, because the main issue isn't the size of the prostate, but rather the problem the prostate is causing in the urethra. Because since the urethra passes through the core, right, the middle of the prostate, it can obstruct the canal, either by growing into the canal or by squeezing the canal. And it's usually in both ways. So how will we know this? Usually we know through the symptoms, so you have to observe the strength of your stream. So if the stream has started to get weaker, especially when you have a larger volume to urinate, that's already an indication that the prostate is causing a problem. When you take a while to start urinating, especially when you have a strong urge. There are also other indirect symptoms, like when you go to the bathroom more frequently but with a small amount of urine. It's not a symptom that is definitely from the prostate. None of these are actually, but they are indicative. Also, waking up several times at night, especially with a very full bladder and a strong urge to urinate, but when you get there, there isn't much urine, that is also an indicator, so you have to pay attention. If you have any of these symptoms, it is important that you see a specialist to be examined, evaluated, and if necessary, have tests ordered to see if there is a need to start treatment or a more in-depth investigation. To monitor and log the urinary symptoms I mentioned, and to be able to generate reports to send to your doctor during your appointments and medical follow-ups, I recommend an app called Prostate Tracker. It's free, and the link is right here in this video's description. A big hug to everyone, and I'll see you in the next video.